Hello, my name is Richard Schellenberger. I'm the Associate Program Director of the Internal Medicine Residency Program at St. Joseph Mercy Hospital in Ann Arbor, Michigan. Today, I'd like to talk to you about my paper entitled Melanoma Screening, Thinking Beyond the Guidelines. For an overview of our paper, we decided to discuss the importance of malignant melanoma in the United States today. This disease represents the sixth leading cancer in this country. We also have noted that this is a very costly cancer, with the cost of treating melanoma increasing 288% in a time period from 2002 to 2011. At this time, we do not have any set screening guidelines for early detection of malignant melanoma in the United States. The purpose of our paper was to examine the United States Preventive Service Task Force guidelines, which came out in July of 2016. We decided to look at these guidelines and see if there's alternatives in screening patients to improve early detection. The takeaway message of this article is that we feel that the guidelines need further examination. We agree that the United States Preventive Service Task Force is very important, and they make several guidelines that are evidence-based. We also agree that the evidence does not completely support the use of widespread screening, as there are no randomized controlled trials. In most cancers, randomized controlled trials do not exist. There are several studies that we have outlined that shows that doctors do pick up melanoma at an earlier stage, and there's even one trial from Germany that showed that there's a possible benefit in mortality in screening for melanoma. We do think that there is room to look at high-risk patients, as they do in other countries, such as Australia, New Zealand, and Canada. Canada has just recently adopted these new guidelines, and incidentally, they have a lower rate of melanoma than the United States does. These look at high-risk patients and patients who have a higher risk of dying from melanoma, like Caucasian men over 50 years old, patients with family history of melanoma or other skin cancers, and history of sun exposure. Our study relates to clinical practice, as we would like to advocate for increased clinicians using the whole body skin exam to screen patients for skin cancers, especially melanoma, and improve early detection. Patients are concerned about this, as studies have shown from the Mayo Clinic and from the Moonshots Cancer Program from MD Anderson that the patients are very concerned about skin cancer and specifically about melanoma. Despite this, only 20% of patients report getting a skin exam by their primary care physician. This is an area that we really advocate for change, especially given the fact that this is one of the only three cancers that has not shown a decrease in mortality currently in the United States. We feel that now is definitely the time for change in malignant melanoma.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.